Hello, thank you all for tuning in to another episode of Better Black News. I'm Jillian Whitaker, as always, and today's episode, we're going to be talking about sexually transmitted infections here in Oklahoma, and it's something that we need to talk about because a certain demographic is disproportionately affected. So today we are joined with Ms. Tarania Harris, who manages their surveillance and analysis department with the Oklahoma State Department of Health. Tarania, how are you today, girl?
Very well. Thank you very much for this opportunity to speak about our area.
Yes. So let's just get right into it. How are Black women, what are our numbers when it comes to STIs in Oklahoma?
Okay, that's a very big question. So today, the STIs we'll be talking about are chlamydia, gonorrhea, and syphilis in particular. And so for those that don't know, Blacks account for about 7.4% of the population of Oklahoma. Black women account for about 3.7% of that population. So we don't make up a very big population of Oklahoma overall. In 2018, when it comes to chlamydia, Oklahoma as a whole was 19th in the United States for the highest rate of chlamydia cases. So out of 50 states, we ranked 19th. Alaska actually ranked number 1.
Oh, wow.
Yeah, I know.
Wow.
Total, all races, we had 21,974 total cases of chlamydia in 2008, with the rate of about 557 per 100,000 population. Now, when you looked at only females, that rate was 768 per 100,000. However, when you looked at Black females, that rate became 1,975 per 100,000, which is approximately 4 times higher than white females. So Black women are disproportionately affected in both chlamydia, gonorrhea, and syphilis. With chlamydia, over the last 5 years, the number has actually decreased. So in 2014, the rate was 2,120 per 100,000, which was reduced down to, in 2018, to 1,975 per 100,000. But again, we were still disproportionately affected.
Okay.
And so that's the biggest thing, is making sure that people know the numbers, know to get tested, and know to get treated.
Okay. What age are young women or girls first becoming, initially infected with these diseases?
When looking at Black females, the age groups that are the largest proportion of chlamydia cases are age groups 20 to 24 years, followed by 15 to 19 years, followed by 25 to 29 years. And we actually see that exact same breakdown for gonorrhea. And let me check for syphilis real quick. The age group for syphilis is 20 to 24 years and 25 to 29 years.
Wow. So do you all have any data with these women? Are they receiving treatment? Do they receive?
Yes, we actually do have that information. So unfortunately, in the state of Oklahoma, we do not receive enough funding to follow up on chlamydia and gonorrhea cases, but we do actively follow up on syphilis cases. So if you are diagnosed with syphilis in the state of Oklahoma, we actually follow up, make sure that, or at least try to encourage you to get treated, as well as notify your partners and get them tested and treated as well. For chlamydia and gonorrhea, we focus mainly on pregnant females because financially, those are the only resources we have. However, we do educate all providers about how to properly treat for chlamydia, gonorrhea, and syphilis, and we actually ask for that information to be reported from them. It is a requirement from CDC, who are our funders, and CDC stands for the Centers for Disease Control and Prevention. And we actually, if we see that particular provider is not treating properly, we actually follow up, send someone out to their office to make sure they're educated properly. So I know that was a long answer to your question.
It's okay.
So
it's okay.
For chlamydia and gonorrhea, and I wrote down everything just to make sure I would remember. 55.1% of Black women are treated with chlamydia and gonorrhea. 55.1% are treated for chlamydia. 47% are treated for gonorrhea, and 93.5% are treated with syphilis. And again, that number is going to be so much higher for syphilis because we actually do active follow-up for syphilis.
Now, I know you probably may not have the data on this question, but I want to ask it anyway. Do we have any idea why Black women are being the ones that's leading in these infections? Like, why are we, getting
That's a
caught up?
great question. There's no real reason for us to know why, but I think we have to look at the public health and medical field as a whole in order to answer
Exactly.
that question.
That's what I was hoping
And
you were
in
going to say.
Oklahoma, in Oklahoma, we know that there truly is an issue with access to care regardless of race. And however, that access does get bigger when you look at race, especially when you look at Black Oklahomans. So access to care and treatment, I believe, is a big one. And when I say access, it's not only transportation, how to get there, but where is it located? If your closest place to get treated is 2 hours away, is it realistic for you to get there? If your closest place to get treated closes at 3 and you don't get off work till 6 o'clock and you have no vacation or annual leave, how are you going to go get treated? So personally, I believe that one of the biggest issues is a real Oklahoma issue as a whole, and that is access to care.
Jesus Christ. Okay. Well, how can people get in contact with you if they have further questions?
Sure. So I work at the Oklahoma State Department of Health in the Sexual Health and Harm Reduction Service. Our main number is 405-271-4636, and we provide a variety of resources. Again, I am over the Surveillance and Analysis Division. If you need any statistical information, we're the ones to provide it for you. If you are wanting more education and prevention, so you want someone to come out and actually do prevention information or education workshop, you will contact our Prevention and Intervention Division. And we also have a care division that focuses on persons who are living with HIV and making sure that they get into care.
Okay. And just one final question. And it may be a stupid question, but I don't want to leave anything up for assumption on the table for anybody watching. How can we prevent us spreading this? Is it just simply by using a condom? I know we can say abstinence, but I want to be realistic. So is it just by using a condom?
I'm so glad you asked that. And then you actually reminded me of something. Yes. The number one way that we can prevent this, well, the 100% foolproof way to prevent an STI is, of course, abstinence.
Right.
However, if you decide not to abstain, you need to use a condom. And at our county health departments, as well as through the Oklahoma State Department of Health, we provide condoms free of charge. So if you do not have the money to purchase condoms, and not only external condoms, but also internal condoms. Internal condoms are what used to be called female condoms. We actually provide both, as well as lube. And I believe that's everything that we provide as of right now, but we provide them free of charge. Mm-hmm. The other thing is make sure that you and your partner go and get tested together and treated together. Because sometimes people are in relationships and they think, oh, you must be cheating on me because you gave me an STI. Well, did the person ever get tested for an STI? Because they don't just go away. You actually have to be treated. And so at the beginning of any relationship, go together, go get tested, go get treated together. The last thing I wanted to bring up is expedited partner therapy. And this is something that is done in all of the county health departments throughout the state of Oklahoma. And so if you go into a county health department and you yourself are test positive for chlamydia or gonorrhea, you can actually ask for expedited partner therapy, which that means that they will give you up to 3 doses of medication for your partners. So your partners technically do not have to come in. You can actually, if you go to one of our county health departments, you can actually get the treatment for your partners and give it to them. So in the event it is someone that has an issue with transportation or getting off work to go get tested and treated, they can still get treated for that STI if they've been one of your sexual partners.
Wow. Wow. You said a mouthful, and I appreciate you taking the time out to speak with us. And hopefully this has helped someone, especially if they were wondering or had no idea. I didn't have an idea when I was researching this, when I was getting our season prepared for what we were going to cover this season. And when I saw these numbers, I was like, wow, like this is crazy. And we need to talk about this because I had no idea. So I appreciate you. And I appreciate everything you're doing with the Oklahoma State Department of Health.
Oh, you're very welcome, very welcome. And just remind people that if you get diagnosed with chlamydia, gonorrhea, or syphilis, these are absolutely preventable and treatable diseases. So this is not a death sentence at all, but you do want to get treated. There are serious complications to each one of these infections. Right. And if you're treated properly and quickly, you should not have any complications at all.
Okay. All right, you all. Well, y'all heard it here first. I'm Jillian Whitaker, reporting for Better Black News, reminding you to be better. And please, after listening to this, please be safe and wrap it up, okay? Y'all enjoy yourselves.